Welcome to ADAPT NCLEX IV Therapy, key aspect of nursing fundamentals. There's a lot of topics that they can ask you questions on. They are basic nursing care. Let's get to it. This is a simple, straightforward lecture. So buckle up and let's go. Before you start any IV therapy, you got to know the indication. So there's indication for IV therapy. It's straightforward, right? It give you access to the bloodstream straight right away. So it's very quickly. Access to bloodstream very quickly. It also allow you in emergency situation to get access. So indication, we use it in emergency. Very good access to get to the bloodstream. They avoid the liver first pass effect. So none of it is destroyed. Get it to your blood. So the same concentration will get, you have a target amount that can get you to the system. Okay, we also can use it when somebody is not unable to absorb the medication. You can absorb it because you have indigestion problem. Yeah, you have digestion issue that become very key. Okay, if the medication is very irritating, yeah, IV route is your bed source. So those are the indication for placement of IV and IV therapy. What type of fluid? We usually use IV fluid, right? So this can be crystalloid. This is crystalloid. And then there's colloid, right? We have colloid, which is albumin. And then you have blood transfusion. We can also use it for what? TPN. Again, this is total fat entry outside the GI tract and nutrition. Patient is getting all their nutrition through IV, right? So those are the key types of fluid we use. Now, if you have to place the IV, you should know what kind of equipment you need. Like I said, this topic is straightforward, no wasting time. What kind of equipment? Well, you need a catheter, IV catheter itself. It can have a needle and needleless, right? You need an infusion pump to infuse the IV. This infusion pump, sometimes they call it electronic. Okay, if you see electronic delivery system, yeah, that's the same as infusion pump. What else you need? Of course, you have a catheter, you have infusion pump delivery system. You may need a filter to filter the IV. Okay, then you got to have the type of infusion you're going to provide. Okay, type of the infusion. And that is, people get confused, and that is whether it's a peripheral infusion. That means the vein outside the in the peripheral system, or is it a central infusion? That means in the central system, central vascular system. Is it a continuous infusion, non-stop? You keep on getting it, or is it an intermittent? So this is like intermittent. You stop it and let it go, stop it and get it go. So just know if it's the peripheral outside, the usually smaller veins in your arms, your legs, and then the central, those within your chest cavity going into your heart. Yeah, those are the big veins. And whether you're going to get it continuously or you can going to get it intermittently. Those are the some of the equipment that we need. There's more equipment you need. You also have to have a tubing system. Okay, the tubing system, there's one that is vented. Some of the tubes are vented, and this is usually if you have a glass bottle. They vented, they have a venting system. Non-vented are usually the plastic bags, and the medications in it contains the medication. Basically, those are non-vented ones. So these are the tubing system. There's some vented and non-vented. Then you're going to have there's some system that have a drip delivery. Is a drip and tubing. And there's two types you have to worry about: the micro versus macro. Okay, the macro drip is used for adults. Okay, and it deliver a very small amount of drips. Basically the time for the drips to be delivered is shorter. Okay, so the delivery of the drops are shorter, so you can have like 20 drops per ml. Okay, even though it's a macro, the micro is multiple drops. It's used for in kids. Okay, so you can have like 60 drops in ml. So the name is a little bit confusing. The micro, there's more drops in the micro than in the macro, which is 60 drops. Most of the time, you can have 10, 15, and 20 drops per ml for adults. If they give you drops 10, 15, you can use it. But if they don't give it to you, it's always 20 if it's a macro in an adult. So those are the equipment that you should be familiar with, that you need to use to have it available. Okay. The IV is also, remember, is the fastest. Is the fastest route to get into the blood system. If we want to get into the circulatory system, this is the fastest. The advantage we talk about bypassing the liver system and other things. The major complication is like fluid overloaded. So you got to check. We'll talk in details about other complications, but the major one is fluid overloaded, where the patient gets too much fluid and start having symptoms. Okay, so that's the first portion of it. Now, you got to place the IV. You got to have certain skills. So this is the skills, how you place it for peripheral IV, PIV, that's what it means, right? So try and get your catheter. Okay, get your IV start kit. The IV start kit, basically. And usually it has a tourniquet. If you have a tourniquet, it can have alcohol wipes. You also have gauze in it. It has a cleansing agent. It's different from alcohol. It has a sterile tape. It has a semi-permeable. This is what we call Tegoden, semi-permeable memory dressing. This is what we call Tegoden, basically, semi-permeable memory dressing. And those are very good because you use it to cover the IV site after the placement. You also will need what? Your IV fluid. Okay, you got to have your IV fluid ready, prime to go. You get your tubing system. You get your filter, like I said. You get your pump. You wear your gloves. And you'll be ready to go. So those are the equipment you need quickly for the skills to be able to place the IV. What do you do? First thing, procedure. Okay, this is very short, straightforward. Explain the procedure to the patient. Hey, ma'am, we got to place IV, okay? And then get their permission. They don't need to sign the consent, but they will say, okay, go ahead, ma'am. They get your permission. You wash your hands. It has to be sterile, lady. Then you identify the vein you want to use. Okay, you want to identify appropriate vein. You got to make sure that for adults like that, the vein you're going to use is between the fingers and the shoulder. If you have to do it in the leg, that's fine. But this is the common place that we do for adults. For kids, okay, you can use the fingers and the shoulder plus you can have it in the scalp. Okay, you can use the scalp, the leg vein, and use it. Okay, you can also use the leg veins to place the IV. So those are a few steps, the beginning of the step. Okay. Now, what do you think you need? After you get this already, well, the first thing you do, you identify the vein, you put your tourniquet on. This is very important. We're not going to kill the artery. We're just tightening enough to close the vein. That's all. That's what we want to do. Just a venous occlusion. That's all. Okay. Then you clean your site. You clean your site. You use the alcohol and then the cleansing agent, antimicrobial agent to clean. Okay. These should be allowed to dry before you place your IV. You have to allow it to dry. When you're using a needle, this is what they put in the selector apply. You have to know some of the steps. Okay. And the needle should be at 10 to 30 degrees. It's like you just right under the skin, not going too deep. 10 to 20, 30 degrees is the most important angle to do that. The bevel is the key questions they ask all the time. Bevel should be up, okay? And then you push it until you get a return of blood. Okay, when you get a return of blood, okay, advance to the hub, okay, until you hub, okay? And then that's when you release, as soon as you hub, release your tourniquet. Release your tourniquet as much as possible. Remove the needle, then dispose it. Okay, then you connect your IV tubing. Apply your dressing. And then you label it. You have to label it. Okay, the time, you have to label the time, date. So you need the time, date it was placed, and then the nurse, your initials need to be there. Time, date, it was placed. Then you got to put a sticker of the same thing. Time, this thing on the tubing itself. Don't write on the tubing, but use a sticker with your name, with time, date, and your initials on the IV tubing itself. This is very, very important. Never use an ink or anything in there. It can leak through easily. So don't do that. So that's the key questions they ask you. If you want to label it, use a sticker, but don't use anything else. The key fact you should know. And this is how they can ask you a question. I know there's a bunch of steps, but they can shorten it, but you got to follow individual steps when they ask you a question on this particular topic. Okay, so that's your procedure right there. Now, there's I got to clean this. There's the types of IV that you have to be familiar with. There's a short-term IV. Okay, those we use for short-term. That means it's just a peripheral IV. You know, you're in the hospital, you need IV replaced. That's all. There's some people who need a long-term. Long-term IV, this is central line. This is central One, they are like central lines. So they get to the central venous system, basically, and they are used for long-term IV therapy. Example is a central venous catheter, that's what we call it, or peripheral catheter, that's PICC line. And these are all lines that they take a very long time to be used in terms of what the purpose of it, especially for like TPN. Yes, people who have cancer and they're getting chemotherapy. Okay, if you need a long-term antibiotic, you're going to use this. If you need a frequent lab draw, we can also use it. If you need a CVP, central venous monitoring, you can also place this. So these are some of the benefits of the central venous being catheters. The CVC is central venous catheter, PICC is peripheral insertion catheter, basically. And that is what is used. And that is what's used for other therapy, especially for TPN. That's what is the biggest use of it. It's peripheral inserted central catheter. Basically, it's the same. If the individual is this, okay, and this is his peripheral inserted. So here, you insert here all the way. Let me clean it. I can draw it better. So if this is the individual chest, basically, the chest is here and the heart is here. There's a big vein, central venous system here. The peripheral system goes like that. So you insert the catheter here and it goes all the way here. This is a PICC line. The CVC, basically, you just start from here and go here right away. It's very short. And CVC, central venous catheter. And those are the ones that we use for long term. There's another information you have to know in terms of the long term. The long-term therapy can be different classification. It's very confusing, but no, don't worry about it. I'll make it easy. Long-term catheter, right? There's those that are percutaneous. Okay. This is through the skin, is non-tunnel. It's not tunnel. So these are not tunneled catheters. They're very simple catheters. They can be single lumen for this group, or double lumen, or triple lumen. These are special percutaneous. They don't tunnel it through the skin. That's what it means. And they can be single, one lumen, double lumen, and triple lumen. And that is like, this is the catheter. Okay, it has just one lumen at the end, or it can have one catheter and you have two lumen, or you have one catheter and three lumen, like that. So you can use these three lumens with whichever purpose you want to use it for. This is the first one. Then there's those that are tunneled to the skin. Okay, under the skin, you tunnel those catheters, you make it. They go into the central venous system. Okay, and you tunnel in the skin to get there. It has a dacron. Okay, this has a dacron cap. This forms scar tissue and it prevents the IV from moving and it prevents infection. The key thing is no steroid dressing after the wound has healed, because the dacron will take care of everything. So that's the tunnel portion of it. Okay, then I briefly talk about this. Okay, the PICC line, peripherally inserted central catheter. Okay, these usually go into the basilic or cephalic vein in your arm, the big veins in your arm. And then they enter into the central venous system. Okay. The next one is implantable venous access port. They have a port, so you implant it. Access port, okay, or device. Basically, you're going to create a packet, okay, and put the port attached to the catheter, and then let me draw it for you. So if this is the individual chest, like that, so you create a packet and you put the port, and this is the heart. You tunnel it, and it goes all the way into the system. So this is the port, and this is where you access it. You don't see it, it's under the skin. So the port is attached to the catheter. And then that's where you go into the central venous system. To access the system, the venous system, you have to use special needle. You call the Huber needle. And these help the port last longer so that you don't destroy it. So this is the skills you have to know. So most people with the chemotherapy, they have this port on their chest. You can see it under the skin in the subcutaneous fat area. But as a catheter that go to the heart. And so to assess this, you take this Uber needle, then you insert it here like that, and you draw, and then get your whatever you want to do with the blood there. But they use it for chemotherapy and other things. Okay. So those are the long-term percutaneous non-tunnel, regular one, and then the tunnel ones are those that last for a long time. Okay. Now, how do you care for this side? Side care for central venous system. How do you care? Because these are questions they like to ask most of the time. Okay. You need to have occlusive dressing to prevent infection. That is, infection is the biggie. So we want to prevent it as much as possible. Okay. You got to change dressing when it's soiled or when it's loose. You got to follow facility protocol. So follow facility protocol. And usually 2 to 7 days is excellent to change it. The gauze, if you just have the gauze on it, 2 days is okay. Most of the time, they want you to have semi-permeable, transparent, okay? It has a transparent membrane gauze, which is what we call tegoderm. It's the same as the tego. Yeah. Okay, you heard it before, and this usually lasts for a long time, like 7 days, and you can take it out. To clean the site, it depends on the facility, but 2% chlorhexidine is enough. Okay, 2% chlorhexidine. Some people will use 70% of isopropyl, that's the alcohol. It depends on your facility, so you got to see the company where you work at, but this is for the site, to clean the site as the insertion site. Okay, there's some strategies to prevent infection. Okay, asepsis technique is always the best, right? Make sure you have a mask on when you're dealing with the central line. Okay, how do you clean it? You clean it up and down, up and down. You clean up and down motion when you're cleaning it. And then when you start centrally and you work outward. So up and down centrally and work yourself up outward. Make sure it's dry. That's the cleansing agent. It's dry before you apply dressing. Okay. You have to look at the side for what? Redness to prevent infection, swelling, erythema. Okay. And then if there's a damage to the dressing, or skin damage to the patient. So all those things is very important that you have to look for. Okay, that's how you can take care of the site so that it doesn't have infection. Now, flushing. Yeah, you can't just flush IV. There's a technique. Okay, you have to follow the agency policy. Every time, follow agency possible policy, but at minimum once per shift. That's how you flush it. Okay, and the volume that you use to flush it has to be 2 times the internal volume of the catheter. So the volume of the catheter, it has to be 2 times, so more than the actual volume of the catheter, so that it can stay in. That's the idea. Okay, it's stay. Most of the time you use saline, but there's some medication saline is not good, so you have to use D5W. You have to check with the pharmacy. This is why you got to follow institutional policy, to figure out. Some may need saline lock or heparin, so lock. So you got to make sure so that you don't clog the catheter. And it's very good for closed tip catheters. Open tip are not, or blunt tip. Closed tip is they need a heparin lock to prevent them from clogging. And this is biggie. Syringe that you're going to use should be greater than 10 ml. It shouldn't be anything less than 10 ml. We're going to bash. You can't use 3 ml and syringe to flush because it's going to burst the tube and it's destroy the system. So don't do that. Okay, that's the key. Okay,